You are now listening to Green Party Radio, coming to you live on the Birdcraft Radio Network. And now, here's your host, Larry Ellis.
Good morning. I'm Larry Ellis, and you're not. I want to start the show today with a moment of silence to remember the 2,996 Americans that were killed on September 11th, 2001. So please, one moment. Thanks, everybody.
Yes.
And it wouldn't. It wouldn't. Well, hang on, Don.
I'm sorry. Go ahead, Larry.
Hang on, Don.
All right.
It wouldn't be right if I didn't also mention the 1.5 million Iraqi civilians that were killed for doing nothing except for living in a country with a lot of oil.
Well, living under a dictator for 30 years, they suffered, and then we just doubled their suffering.
Yeah. We ended their suffering all right.
Yeah.
But, there's dictators all around the world. We're not getting rid of all of them. There's a dictator in North Korea right now. Why aren't we invading North Korea? Wait a minute. I can answer that one. There's no oil in North Korea.
You serious?
What?
There's no oil in North Korea?
I don't think so. I'm pretty sure we'd be there if there was.
Yeah, they'd be a trusted ally if there was oil there.
Sure. No.
Yeah, I mean,
I can't. The entire United States population got duped on September 11th.
Yeah.
Myself included. They fooled us all.
Oh yeah, hey, I was right there along with, and say what you want, W was a horrible president, but I give him credit for that one day. He actually acted right, did the right things, said the right things. I give him credit for that one day of his presidency. On 9/11, he was a good president. Now the rest of his presidency, yeah, we all know how it turned out. But yeah,
well, I don't know, Don.
I bought in.
Don, he was the president. Why, when all the planes got grounded and couldn't fly, they still found one to fly Bin Laden's family out of the United States?
Well, he probably had nothing to do with that. That was probably his dad. He already had that set up. So put that one on.
Well, yeah. I mean, as far as saying not having anything to do with it and culpability, of course not. W was an idiot. I mean, he was a bigger puppet than Ronald Reagan.
Oh, yeah, he was. But Kennedy was the president.
But
yeah,
here's the problem. The puppet masters are pulling Hillary Clinton's strings right now, too.
Well, sure they are.
And the American people are falling for it. Hook, line, and sinker.
Hook, line, and sinker. Oh, yeah, no doubt.
I saw an email last night. I couldn't believe it. It said Hillary Clinton was worried that Donald Trump was going to rig and try and steal the election with voter suppression. We have to stop it.
You know what that's like? I'll give you the perfect analogy. That's like the Iron Sheik worrying that Sergeant Slaughter was going to pay off the referee in a wrestling match.
Right. So we got a special guest today, Don?
Yeah, a well-educated, well-spoken guest. It's going to make us sound stupid, but that's okay. We're here to, educate, so we don't mind if Dr. Joe Imperato makes us sound kind of stupid. Yeah, he's a Harvard-educated oncologist. He's the past president of the Illinois chapter of the American Cancer Society. He's also the past president of the physicians at, you've probably heard of it, Lake Forest Northwestern Hospital, which is, at Northwestern University. It's one of the finest hospitals in the country. He's here to talk to us about, one of the Green Party's biggest platforms, and Hillary talks about it too, but it's all just blah, blah, blah. She doesn't mean it. Medicare for all. When Obama pushed through Obamacare, he could have done Medicare for all. The Democrats controlled Congress. They could have just said, yes, everybody gets health coverage, and they could have passed it, but they didn't because they didn't want to. But
they didn't want to. Absolutely right, because when Obama took office, we had control of the Senate.
Exactly. For 2 years, and the House. The Democrats ran it all. They could have done whatever they wanted. And
he chose not to do Medicare for all.
Exactly. But
absolutely,
to a lot of people, from what I'm told, doctors really they think it's a great idea. We're going to go ahead.
I know nurses do.
Line. Yeah, we're going to go ahead and put him on. I think he's on now. Yeah, Dr. Joe Imperato. It's great to have you on the air.
Thank you for having me, gentlemen. Good morning.
Yes, sir. I'm just going to call you Dr. Joe because I don't want to destroy your last name, sir.
That's okay. You did a pretty good job.
Well, that was my brother.
Yeah. Yeah. I hope you don't get confused. People say we sound pretty much alike. We try not to, but I mean we're brothers, so we kind of sound the same.
That's okay.
You can tell the difference because I'm the one that sounds smart.
Oh yeah. All right. Well,
did I say smart or smart ass? I'm sorry.
We'll get started with Larry's over there. He's gone senile apparently. Which what I touched on. Now you stated to me when we had some discussions before the show that you and other physicians started talking about Medicare for all as far back as the late 90s. Why did doctors think that's a good idea?
So you have to realize 90s were a pretty tumultuous time because Hillary Clinton came out with her what ultimately turned out to be a failed health plan, basically a precursor to Obamacare. And what happened at that time is because people thought that law was going to be passed, there were a lot of hospitals that bought up physicians groups. Then that failed, and they ended up firing all these physician groups. Then we had the tech bubble burst in '98. We had a lot of people that were out of jobs, uninsured. We also had problems with the HMOs and with narrow networks, meaning if you wanted to come see me, but I wasn't in your network, you couldn't come see me. So there was just huge problems with the healthcare industry at that time. And on top of it, at that time in the 90s, Medicare paid, relatively speaking, they paid quite well. And they paid in a very straightforward fashion, so it was very easy to bill Medicare, and you knew exactly what you were going to get. So back at that time, we started saying if they want to do this, why not just make Medicare available to everybody and just be done with it? The other problem, too, is the private insurance industry, especially at that time, the overhead was something like 30 to 40% was administrative costs. And with Medicare, it's less than 10%. So we foresaw that there would be a lot of potential for savings as well. So that's what precipitated back in the 90s.
So you're saying that, and I'm sure it's still the same today, if not worse, because we know that drug companies spend on advertising versus research, it's like 18 or 19 to 1. You're saying the big problem, like you said, 10% versus 30 to 40%, people don't want to believe it. But the big problem with medical coverage today is insurance companies and their CEOs have to make millions of dollars. They're the problem.
Well, it's certainly a part of it. Now, the law has changed, and I think they're limited to only making 20% profit. I believe that the law has changed. So they can only, quote, make 20% profit. But nevertheless, a lot of healthcare dollar goes to that overhead.
Yeah, well, that sounds about right. I guess just kind of a follow-up. What are, you kind of touched on it, what are some of the frustrations that you as physicians deal with when you're trying to deal with insurance companies? It's got to be frustrating.
So right now, the biggest problem that we face is I see. So I'm an oncologist. I'm a cancer specialist. So everybody that comes to me has a diagnosis of cancer. So these are not just random people walking in off the street. These people all have cancer. They're all in so they can get treatment, and I treat with radiation. So in order to treat a person properly, there's certain tests I need to order, and then I can determine how I want to treat them. And in the past, that was fine. That was all well and good. I ordered the test I needed. I set up the plan the way I wanted it, and that was fine. Now the insurance companies start to second-guess me. So I want to order a CAT scan or an MRI or a PET scan. Insurance company, I say, well, we're not paying for that. And it's like, why not? It's like, well, because it's not indicated. And it's like, well, I understand what you're saying, but in this case, it is indicated because this particular patient has blah, blah, blah. They don't care. Then I want to treat you in a particular way, and I don't want to get to the technical details, but basically there's different options in treating with radiation. But the insurance company may not allow it. They may say, no, you can only treat this way. And in the past, when that occurred, we could usually do what's called a peer-to-peer. So I would call the insurance company. I would speak to a doctor. The doctor would say, yeah, I understand exactly what you're talking about. Go ahead. And they give me approval. Now, it's no, that's not what our guidelines say. And these insurance companies, they all have their guidelines, and if it doesn't fall in the guidelines, the answer is no. It's just no.
Are these guidelines, are they set by doctors?
Well, so here's an interesting thing. At one point, I was actually a recruiter called me for a job working with one of these companies. And I actually pursued it. I looked into it and actually spoke to a doctor I knew who was doing the job. And, he's telling me kind of what his day was like. And then he goes to me, he goes, now you do realize that you're not just going to be doing making decisions on cancer patients. I go, what are you talking about? He goes, oh, well, you'll be seeing cardiology cases and orthopedics and neurosurgery. I go, what the hell do I know about that? He goes, don't worry, it's going to come back to you, plus we have these guidelines. And I'm thinking, holy crap, I haven't done like cardiology since medical school. I don't even know the names of drugs anymore. So these guidelines are what are theoretically considered best practices. They are put together by medical teams, but guidelines are exactly that. Guidelines are guidelines. They may apply to 95% of the people with that diagnosis, but there's going to be exceptions. There's
right.
Always,
it's like that applies to the medians, right?
Right, exactly. So the problem is, and granted, there are times where doctors we waste. There's a lot of stuff we do waste. We do order. There are unnecessary tests that are ordered. There are unnecessary treatments that are given. I mean, I grant you, we're not perfect in that regard by any stretch of the imagination, but we've lost all flexibility in trying to make the care specific to that individual, and it's frustrating, and it's very frustrating.
Well, when you give authority to deny access to care to an insurance company who only looks at the bottom dollar, the bottom line, that's what's going to happen.
Right.
It's set up to be that way.
But in some ways, this is the direction that healthcare is heading, and probably to some degree has to head because of just the amount of dollars that we're spending. And like I said, part of our problem is we do waste a lot of healthcare dollars.
Sure. I mean, there has to be some kind of. I mean, you can't just go willy-nilly because, just like any other field of work, not all doctors are 100% honest. Some of them are just going to order tests that they know the patient doesn't need just so they can get paid and, buy a new Corvette or whatever sports car doctors drive. Now, I mean, I guess even if Medicare for all, there would be limits, right?
Oh, absolutely. I mean, one of the biggest problems we confront today is what's called futile care. So you'll see an 89-year-old grandma, with widely metastatic lung cancer, it spread throughout her entire body, and and people are saying, like, well, we want everything possible done for Nana. So she ends up spending the last 3 weeks of her life in the intensive care unit with a tube down her throat while she gets one more cycle of chemotherapy, which does nothing. And in the meanwhile, we've spent hundreds and hundreds of thousands of dollars on those last 3 weeks of care, and that accomplished absolutely nothing. We've got to draw some of these lines, and that actually. That exact example is what started the whole thing with Obamacare, with the death panels.
Yeah.
And we're going to kill grandma, stuff like that. No, we're not going to put a pillow over grandma's face. But what we're going to do is, when there's really nothing more for us to offer as far as treatment, make sure that she's comfortable, make sure that she's cared for properly, make sure she has hospice, make sure that the family has support so that she can die in peace at home instead of 17 tubes shoved into her body.
Yeah, that was kind of my line of thought. Larry and I had this discussion last night. Yeah, instead of spending your last 2 weeks of your life in a hospital stuffed full of tubes just so your family could come visit you for an hour a day and basically look at you when you're, I mean, it sounds bad, a vegetable, and have no chance of recovering. Like you said, to go home, die in peace, your family's there at 7, and you may, like you said, you may pass 2 weeks earlier, but you've saved $1,000.
Right, hundreds of thousands of dollars. And so I mean, there's a lot of aspects of where we can improve on our care and save money, and we're not denying care.
How do we go about lowering the price of prescription medication in this country? Because there are far too many people that just can't afford to take their medication, can't afford to buy it.
Yeah, that's a great question.
I'm not retired. I make a pretty decent living, and I've been given medication by doctors that I had to go back to the doctor. I couldn't afford to buy that. I just couldn't do it. So I've gone without it. And I can't imagine. And I'm not even 50. I can't imagine somebody on a fixed income. Go ahead.
No, I'll say, let me follow up on that because I have a good personal story for you. Thanks to my indiscretions as a youth, I had hepatitis C. Fighting with Aetna, who Aetna's trying to pull out of Obamacare on a related note, but I've had all my tests, blood work. I had a liver biopsy, which is a surgery. To prove that I have stage 3 cirrhosis in the liver, I really need to get rid of this hepatitis. Now they've come out with a medication, Harvoni, that's 95% effective. I can be cured.
Right.
Aetna's doing everything they can, still haven't approved me, because here in the United States, Harvoni costs $1,000 a pill, and it's like $70 or $80 a pill in other countries. So yeah, go ahead, Doctor. What can we do about these crazy prescription prices? Anything?
All right. Well, let's just start from the beginning. Medicare, by law, may not negotiate drug prices. Now, you stop and think about that for a minute, and you think to yourself, what was exactly going through Congress's head when they passed that law? And obviously, nothing was going through their head, but money was going into their pockets. I mean, without a doubt. So, I mean, it's patently absurd. Just the whole that is patently absurd. The frustration is universal, including both for me with just the pills that I got to take and pills that I prescribe. It makes no sense that we are paying, double or sometimes triple or maybe even quadruple what people in other countries are paying for the same medication. Now, the argument historically has been from the drug companies is, well, look, if you don't give us these prices, research and development is going to grind to a halt because we need this money to research these drugs because, and they're a little correct in this regard, the FDA, the way the FDA works, it is very, very expensive to bring drugs to market. I grant them that. And my response to that is, okay, well, you know what? the world is benefiting from these drugs. So if they don't want research and development to grind to a halt, well, then they should be ponying up more money as well. Why do we have to bear the entire brunt of that? So they've got to change that law. They've got to allow Medicare to be able to negotiate drug prices with these drug companies. I mean, there's just no other way around it. And but it's going to be a tough battle. I mean, the pharmaceutical industry is a very powerful lobby, and I don't know. I don't know. Some of these things, like the EpiPen, for example, where it's almost like they're scoffing at people by saying, "Hey, we're just going to arbitrarily, increase this price, by a ridiculous amount." I don't know. I think that's got to come to an end.
Wasn't the EpiPen, wasn't the research for that funded by the government in the first place?
Yes,
I'm pretty sure it was.
Yeah.
So they can't use the excuse. They can't use the excuse of research and development for that drug. The government funded the research for that drug in the first place.
Yeah,
that's just a straight up price gouge is all that was.
Right.
Yeah, it's all profits. And as I touched on earlier, it's starting to get out there now. People are starting to find out that drug companies spend like 18 to 1 advertising versus research. They can't blame it on research. It's advertising, and I don't understand because I've never personally watched a commercial for a product and said, "Oh, hey, and let me call my doctor and see if he'll give me that," because the doctors already know what they need to give their patients, right?
Direct-to-consumer advertising has confused me. Honest to God, as a physician, direct-to-consumer advertising has confused me from the get-go, other than maybe the Viagra.
Over the counter.
Now they have the latest Viagra. Now they have a mistress. They don't even act like it's going to be like your wife. And now it's like a commercial with a mistress in it. And you don't want to be embarrassed in front of your mistress. But other than that one, some of these others, I'm sitting there, restless leg syndrome, and I'm going like, who the hell has this? I mean, like, what is this? But what it has done, believe it or not, apparently people do go to the doctor and say, "Hey, I think maybe I need this drug or maybe I need that drug," and some of these things are not hard and fast diagnoses. It's not like strep throat where I can do a culture and prove you have strep throat. So apparently it works. I mean, they wouldn't do it if it didn't work. But they think that's one of the reasons drug costs are going up is because people are coming in literally requesting these drugs based on a commercial.
Yeah, and I'm assuming, doctor, that a lot of times they see this commercial and they go ask for this drug that they're going to spend $500-$600 for the prescription, when you can prescribe them a generic or a different drug that's going to treat their problem just as well.
Absolutely. Right.
Yeah.
Now some of these drugs don't have generics. So those are the ones where those are the ones I think that are more commonly advertised because the drug company doesn't want to risk that generics are going to get prescribed.
Oh, sure. But in that case, you probably there may be another drug you can prescribe that is either cheaper or there is a generic.
Right. Yes.
Yeah. Okay. That's kind of what I thought.
Yeah.
I have never in my life gone to my doctor and suggested a drug that I saw in a commercial.
Yeah,
I understand people have to be doing it or they wouldn't advertise it, but it just doesn't make sense to me. I go to the doctor for his opinion, not to give him mine.
Well, thank you. As a doctor, let me tell you, I really appreciate that.
Not a problem, sir.
And now I see, and I knew about Harboni. I was first diagnosed with Hep C in 2008. It was an accident. I had blood work done because I was having surgery on my shoulder. I found out that I had this. And my doctor at the time told me, don't go through the treatment. The old treatment, I don't remember what they're called because they're obsolete now. They were horrible, had horrible side effects.
Oh, it's interferon.
Yes, thank you. Yes, interferon. My doctor told me, that look, this drug is coming out soon, this Harboni, and it's a miracle drug. It will cure Hep C. So I knew about it and didn't go for the treatment then. But now I see the Harvoni commercials everywhere. But yeah, doctors are telling patients usually about these drugs before they ever come out. You don't need to advertise.
Right. Right.
A little bit. This is a flip. So on your blog, I forgot to mention that before you come on. I'm sorry. Dr. Jill also writes a blog for ChicagoNow.com. Go to ChicagoNow.com. It's Healthcare Mythologies, and it's a really good blog. A lot of mythologies. I mean, basically, it's right there in the title about healthcare. The people have all these ideas in their head, just like seeing a new drug and that'll work for me. A lot of misconceptions in their head, and Dr. Joe tries to dispel them. It's a really good blog. Go check it out. ChicagoNow.com, Healthcare Mythologies. And now, one of the things that you say right in your bio on the blog, you don't get into political things, which is perfect for what you're writing. But I want to touch on a political thing for just a minute. What do you think about Dr. Drew? You've probably all heard Dr. Drew. It's Dr. Drew Pinsky, I think is his last name. He got fired. They took his show off of CNN simply because he speculated about Hillary's health. What do you think of that?
Well, in fairness, let's be Dr. Drew, Dr. Oz, Dr. Phil. Okay, these are TV doctors.
I'm sorry, doctor. I left that out. They're not doctors anymore. They're TV personalities.
Okay. I mean, they have medical degrees. Don't get me wrong. But they're TV personalities. And listen, he who pays the piper calls the tune. I think if you're working in that industry, and remember, he apparently speculated at one time about Hillary and had to retract his statement. There was an episode where he speculated about Hillary's health. He had to retract his statement. So my guess is he probably got warned, saying don't do that again. You embarrass us. And then he went and he did it again. And that's just the way it goes. I mean, I think they had the show has. I mean, the network has every right to decide who they want on their shows.
Oh, sure. I mean, and, say what you want about CNN. They call it Clinton News Network, which is not that far off from the truth. But, I mean, you are right. If, they're writing your paycheck, just like you can't walk in the office and call your boss a jerk, he's probably going to fire you. So, I mean, I understand that. And, and you may not be comfortable with this, and I don't know how much you follow politics. What do you think? I mean, do you feel like giving an opinion on what you see from Hillary? I mean, do you think she's suffering from some disease? Okay. So first of all, you have to realize doctors love trying to make these mystical diagnoses. I mean, doctors have written for years about how did King Tut die, and did Abraham Lincoln have Marfan syndrome, and we love to speculate on this crap. But it is speculation. And I belong to there's a doctor's medical bulletin board called CERMO, SERMO, and doctors from all over the world will speculate. This is what we know about Hillary. We know she had a concussion. We know she had twice she had deep venous thrombosis, which means blood clots. She had blood clots. And the big thing now is she has this cough. And again, some people say, well, she doesn't really have this cough. It's just that people put together multiple episodes of her coughing, so it looks like she's coughing all the time, but that's really not the case. And the problem is the diagnosis can run to allergies, as she's claimed. Some people have speculated maybe esophageal GERD, gastroesophageal reflux, all the way up to does she have lung cancer? Does she have sarcoid? Does she is she throwing pulmonary emboli?
I've heard syphilis too.
Syphilis, really?
I don't know that syphilis gives you a cough. I don't think syphilis.
No, I've just heard that